Before we start, what are some of the things you know about bipolar disorder? Bipolar disorder is a mood disorder which includes one or more manic episodes with or without a major depressive episode. Kate, an 18-year-old straight-A student in high school, was just recently admitted into a psychiatric unit at a local hospital. Kate's grandmother recently passed away and had a history of bipolar disorder. During Kate's first week back at school, her mother noticed her poor grooming and inability to sleep. Kate's mom assumed this was Kate's way of grieving her grandmother's death. Kate's teacher also reports that she becomes easily distracted in class and cannot sit still. Within the past week, Kate abruptly quit her job of 3 years as a sales associate, claiming she was too good to work here. Kate stated that she came home that day really excited about how she quit her job and told her mother she was on to better things in life. Kate stated that she suddenly started crying out of nowhere. Kate's mother noticed her change in behavior and labile mood and connected it to her mother's behavior from the past. Kate's mother convinced an irritable and irresponsible Kate to admit herself into the psychiatric unit at the end of the week.
What signs and symptoms of bipolar disorder does Kate possess? Family history of bipolar disorder. Trigger, grandmother's death. Poor hygiene, being a female. Inability to sleep. Abruptly quitting job. Labile mood, easily distracted. Poor grades, and increased activity. Can't sit still.
Hi, I'm Dana. I'll be your nurse today. Do you mind if I look at your name, babe?
Sure.
Can you tell me your date of birth?
3/14/97.
Okay, perfect. Just wanna talk a little bit about why you're here. Mom, do you mind stepping out?
Yeah, no problem. It's gonna be okay.
Hi, Kate. I understand that you voluntarily admitted yourself to the hospital today. Can you tell me what brought you in here today?
I just don't feel myself.
Can you elaborate on that a little bit?
So my grandmother just passed away. My grades have been dropping. I haven't been sleeping well. I just recently quit my job. My teacher complains about me all the time, and I'm happy and then I'm sad, and something's wrong with me.
When did you start noticing these symptoms?
Probably right after my grandmother died.
Why did you quit your job?
I thought I was too good for it, but looking back, it was a really good job, and I'll never get a job again because I freaked out and I lost it.
Has anyone else in your family experienced these types of symptoms before?
Well, my mom convinced me to come here today because she thinks I'm showing signs like my grandmother, and she had bipolar.
Okay, Kate, one last question, just to ensure that your safety. Have you been having any suicidal thoughts or anything similar?
No.
Okay. You're in great hands, and I will be back to talk to you in a little bit.
Okay.
What nursing diagnosis do you think the nurse will come up with?
So, doctor, I just met with Kate, and after speaking with her, the nursing diagnosis I received were sleep deprivation, labile mood, ineffective coping, complicated grieving, impaired cognition, and ineffective impulse control. This all began after her grandmother passed away, so.
Okay, it sounds like she's experiencing bipolar disorder. I'll do some more follow-up on her charts and a little bit more research on her, and I'll get back to you and we can come up with a care plan for her.
Okay.
The doctor diagnosed Kate with bipolar disorder. She prescribed lithium for long-term prevention.
Other medications for bipolar disorder: anticonvulsants, atypical antipsychotics, benzodiazepines, and calcium channel blockers. Okay, Kate, so I see the doctor has diagnosed you with bipolar disorder and prescribed you lithium. Do you know anything about this medication?
No.
Okay, well, this medication treats mania and long-term prevention of bipolar disorder. In order to start the medication, we're going to need to do an initial assessment and monitor your levels of lithium throughout your treatment to prevent any toxicity of the medication. It's also very important to know the difference between your side effects and the toxicity of the medication. Some side effects that you might face or see are weight gain, hand tremors, lethargy, acne, maculopapular rash, and nausea and vomiting. If you experience any of those symptoms, then that's completely normal. But if you experience any symptoms of a coarse hand tremor, hyperactive deep tendon reflexes, tinnitus, vertigo, and seizures, then you should see your healthcare provider immediately because you might be experiencing toxicity.
What's tinnitus and what's vertigo?
Tinnitus is when you feel ringing in the ears, and vertigo is when you feel like the room is spinning and you're very dizzy.
Okay.
It's also important to maintain stable lithium levels, and by doing this, you're going to need to drink at least 2 to 3 liters of water a day to maintain stable balance. After exercising, you're going to want to replace the fluid and electrolytes that you lose during that activity.
Okay.
Do you have any more questions about the medication?
No, but how am I going to remember all this?
So here's a pamphlet of all of the information you need to know about lithium that you can take home in case you have any more questions.
Awesome, thank you.
After teaching Kate about lithium, the nurse and doctor talked to her and her mom about the plan of care after the hospital. The nurse described short-term goals and long-term goals for Kate.
Hi, Kate. So I'm the doctor. We're going to talk to you about the short-term goals and the long-term goals for you and your recovery. So since you voluntarily admitted yourself here, you just have to stay for 3 days, and then we're going to determine after that how you're doing and if you need to stay longer. So, nurse, do you want to talk about the short-term goals?
Some of the short-term goals that we're going to work on are making sure that you have better hygiene. So we're going to make a routine for you to wake up, shower, in order to start your day. We're going to work on your sleep hygiene. So we're going to have a routine schedule, and you're going to go to sleep and wake up at the same time every day. We're also going to work on relaxation techniques to decrease your anxiety, and we can work on meditation, breathing techniques before you go to sleep. We're also going to, in order to work on your coping about your grandmother's passing, we can talk about the memories that you've had with her and talk about maybe visiting her grave. And we're going to maintain a routine schedule for your outpatient of school and your job for every day.
This seems like a lot of things, but each day we're going to work on something new, and we'll make sure that everything is at the right pace for you.
Okay.
And then your long-term goal that we want for you is that you will be emotionally responsive and return to a pre-illness level of functioning and be able to perform everyday tasks and not have so many disruptions, do better in school, and all of that stuff.
Sounds good. So how am I going to develop proper coping mechanisms for like my labile mood and my grieving and everything?
Well, if you find yourself in a situation where your moods are fluctuating, then just we're going to try to remove yourself from the situation that's triggering the episode. And you can find a nurse or psychiatrist to talk about your feelings and engage in activities that can increase your self-esteem. And there's many different groups that you can attend to modify any dysfunctional thinking that you're experiencing and to learn to cope with any of the stressors that you're experiencing.
Okay.
Kate stayed in the hospital for 3 days and improved each day. She worked on coping mechanisms and started a regular regimen for lithium. 4 months after discharge, she came back for her first lithium level screening.
Hi,
Sorry.
Kate. How are you today?
Good, I'm feeling really good.
Have you been taking your medications as prescribed? Your lithium levels are looking really good.
I have been. I've been feeling really normal, like kind of how I used to be before my grandmother passed away.
How are you doing with that, by the way?
Really good. I go to her grave now and I think about good memories that we've had together. It's really helping me.
Have you even found yourself feeling any manic or depressed episodes lately?
No manic or depressed episodes, but my hands are constantly tremoring. Is that normal?
It is normal. Hand tremors are a side effect of lithium, so it is normal. If it starts interfering with your daily life, then you need to come back and let us know.
Okay.
Have you found a job since leaving the hospital?
Yeah, I recently got a job as a checkout girl. I really like it. It allows me to interact with customers and I go right after school. So it's a really good routine in my schedule.
That's great, Kate. And have you had any regular psychiatrist visits scheduled?
Yeah, I actually have one coming up. I really like my doctor. He stays on top of me and I can really trust him.
That's awesome. We're all so happy you've been doing so much better. Keep up the good work.
Thanks.